Good morning, everyone. Welcome to our webinar on digital solutions for workforce optimization in aged care. We begin by acknowledging the traditional owners of the land from which we meet today. Here in Sydney, I'm joining from the land of the Gadigal people of the Eora Nation, and we pay our respect to elders past and present. We also extend that respect to Aboriginal and Torres Strait Islander peoples online today. So before we begin the webinar, just a few housekeeping items to cover. So all of you are automatically on mute. You will probably not be able to communicate with us through the voice, but we do have questions button, which you can see on the screen. Use that to answer or ask questions throughout the webinar. We'll try and answer as many of those as possible, but if you're not able to get to it, we will come to you after the webinar. In case if you are having issues with the webinar, I think there is a button somewhere there on support. So just press that button and we'll get things sorted out for you. BDO is a global professional organization, and we have done a lot of these webinars to share the insights that we have of what we are seeing in aged care. So James, we'll start with you. Can you tell us a little bit about what your role is within Pride Living and what you're seeing for workforce optimization in your clients that you're working with?
Okay, sure. Thanks for that. My name's James Saunders. I'm a partner here at Pride Aged Living. I'm originally a clinician, a registered nurse, and have worked in aged care for the majority of my career. About 10 years at the service delivery clinician end, and then worked for what's now ACPA, Australian Aging, I think is the new title, from next year, for 3 years as a nurse advisor. And then I became a CEO with 11 homes across Queensland and New South Wales for 10 years. And then we went into the consultancy space after that, so Pride Aged Living. So Pride Aged Living is a consultancy firm that specialises in strategy and governance, and my area, which is more operations at the residential aged care. We also have a partner in home care, and then we've got a whole nursing clinical team that helps organisations with clinical audits, etc. So in particular for this today, my interest is that I do a lot of roster reviews, having worked at the facility management level and as a clinician and even in my laser days, it was a lot of work around rostering. We know 70% of our expenditure is around workforce, so it's been always really important to get that right. So what we saw with the legislation was this introduction of care minutes, which in a lot of ways made this whole mission easier, made the goalposts easier for the industry. But if we talk about this, the new Aged Care Act that's coming in, it's still in the bill format, being debated today in the Senate. Hopefully we'll have a new Aged Care Act by the end of the year. It signals a whole person-centred approach to funding in aged care. The government's saying that they're going to fund clinical care. There's no means testing associated with that. So it's consistent with their Medicare approach that all Australians have access to free health care. I'm using my words very carefully here, and I'll explain why. Residents will be expected to continue to contribute to their cost of accommodation and their everyday living costs. And this is why I'm using my words carefully. Everyday living costs is not just hotel services, in other words, getting my meals and cleaning and my laundry done. It is actually if I need help in the shower, if I need help with anything that a carer would do in an aged care facility, does come under the means testing arrangements. The government's also signalled as part of this new model that providers are not there to try and get earnings out of government subsidies. So ANAC is primarily for the delivery of human resources. So what we've seen with that, the RUX research that was done by University of Wollongong for ANAC found that 75% of ANAC funding is appropriate to meet your care minute targets. And that leaves you with 7 to 25%. It's not dictated how you spend that 25%, but we know from the Stewart Brown benchmarks that's typically adequate to meet your other care, which is allied health and lifestyle, and what we call hotel services costs as well. So adequate ANAC there, I'm showing my age. ANAC should be appropriate to meet your wage costs, including superannuation, workers' comp premiums, etc. So the challenge that we've seen is that we started off with the initial target of 200 minutes, and we saw on the 1st of October that increased to 215 minutes, of which 44 minutes met by a registered nurse. 10% can now be delivered by an enrolled nurse in that figure, and the remainder by a personal care worker in the delivery of direct care. Just to give you a bit of background, where did they come up with this? So 215 minutes. Well, that equates to 3.6 hours of direct care per day. There's been research, particularly done in the US, time and motion studies and multivariate analysis, that suggests that 3.6 hours will deliver a good standard of direct care. Best practice, if you're interested, is actually 4.3 hours. What do they mean by best practice? When they added more staff beyond 4.3 hours a day, there was no discernible increase in care outcomes for residents. So ANAC at the moment, to be able to provide that 3.6 hours is, we know the national average is now $305 a day. So that's all the Monash's. We've also got the hotelling supplement of $12.55, which is primarily a wages subsidy. So you're looking at about $317.55 per day per resident, and that should be adequate to meet your staffing costs. So as I said, you could argue this has made life a lot easier. But what's really important is that focus towards direct care, and we know there's been a lot of debate about that there's been no care minutes for allied health. The Royal Commission actually recommended that there be care minutes for allied health, but that didn't happen. What we've seen instead in the new Aged Care Act, in the rules, if you've looked at the service list, we've now seen that they've been broadened to expand fitness. So whilst we've always been required to provide habilitation, short-term rehabilitation, mobility programs, there's now going to be a requirement if the rules are passed that we actually provide an active fitness program. And I believe that was a way to ensure that there's an active allied health presence in residential aged care. So what are the challenges that this provides? What it's done in the care minutes, and it's pretty clear, is they've tried to adopt the same model we've got in home care. Home care was about a consumer-directed care model. In other words, it was holding providers accountable primarily to the resident or the client or consumer. I don't like the word consumer, but let's call them a client in the home care space, primarily to the client, and then to the government that they have acquitted the funds that they've been given appropriately. This is exactly what we're seeing with the care minutes. We will see an environment where part of those monthly care statements is that consumers, their families, will be saying, can you demonstrate that my mother got her 215 minutes per day? And we'll have that obligation. And part of these reforms also included the introduction of 24/7 registered nurse coverage. This 50% of the industry used to be what we called nursing homes, and they generally had 24-hour registered nurse coverage, but 50% were what we used to call hostels. All right, they combined the two in July 2014 because they knew we needed 4 times the amount of residential aged care places before we get the peak of the baby boomers in 2045. So overnight, they converted all those hostels and aged care nursing homes together to be able to take high care residents and double the number of places overnight. So this has created some challenges for, especially for those traditional hostels. One of the biggest challenges is that hostels in particular had a very hospitality focus. We saw serveries in the dining rooms because we had it was an era where residents would walk up to the counter and pick what meal they were going to have. With the high level of acuity now, that's less important. But serveries, for example, are very labour intensive. And with this focus now on direct care minutes, we really need to realign our hotel services model to align with the Stewart Brown benchmarks if you're going to remain financially sustainable. So in the short term, some of the challenges are only 92% of homes have the 24/7 RN coverage. So we've still got 8% of homes that are unable to meet that yet. And more significantly, Stewart Brown say that about 10% of all care minutes for registered nurses are delivered by agency staff. We know the cost of providing that is about $128 an hour compared with internal resourcing about $82. So this is not sustainable in the long term. We've seen huge peaks in these agency costs, particularly around the 24/7 RN coverage. But the government has been assuring us that this is a short-term issue for the industry, where they've created the overseas Pacific solution and encouraging us to recruit from overseas, and we are seeing this, but we're not there yet. But the fact that they're saying 92% of providers are achieving it, in the government's eyes, this program is meeting their objectives. So in addition to that, we've got ongoing challenges now around this. So let me split them up: demand and supply. So once you've got your workforce, the big challenge is then around managing care minutes is around occupancy, right? There's only two variables we really need to worry about. And the first one is, if my occupancy goes up or down, then I need to recalibrate my care minute, my roster in terms of direct care minutes. The second one is changes in resident acuity, which will also affect my care minute targets. And it's been really interesting, particularly in those what we used to call hostels. Most of them were in the for-purpose sector, the charity sector, and were designed to meet a particular population. So VCRSL to meet the care needs of veterans in the community. So it wasn't so much of picking and choosing who you will take. What this new model makes us ask the question, do we need to set a minimum entry criteria and at class for entry? Because in the past, when we've said, if you've got approval from My Aged Care to enter aged care, we'll take you. But we now really need to think, is that appropriate? Because if I start admitting residents with a case mix that is different to my existing residents, for example, they have a class 1 to 4 case mix, and the residents who have exited the facility had case mixes around 11, 12, 13, you're going to have to start thinking about removing carers from your roster. And that's what we don't want. Aged care may not be the highest payer, but what we can offer is stability in our workforce. So what providers need to do is think about an entry criteria. And again, morally, we can do this, but we can say the government strategy, living longer, living better, was about saying Australians want to stay home for as long as they can. And a residential aged care, it's only talking about 15% of people over the age of 80. That would only be in the shorter end period of their life if required at all. As we say, most people will actually die at home or will have just actually been in the hospital the night before. So that's what Australians want. So we as residential aged care providers can stand with hand on heart and say we have an entry profile that is appropriate to our staff mix as well to meet your care needs. And that is controversial.
Yep. So James,
Yeah.
can you hear me? Yep. Sorry.
Yeah,
Yeah.
sure.
Look, you and I, we have worked together on a number of clients, and I think the themes that you're talking about is consistent around challenges with workforce And I think this constant need to balance the supply and demand side of it, and with the regulatory changes that are happening, plus a shift towards a consumer direct model, I think that's just making it the whole supply and demand balancing now need to happen more frequently in a much more sophisticated manner, which is what sort of creating the whole pressure within the ecosystem of how do we actually manage the workforce, how do we optimize the use of that. And I
Yeah,
think that's what I think you are hearing from your client base, what we are hearing from when we are going through this process. But maybe let me just bring the audience into this conversation also, given that there are a number of people who are representing different organizations and they are living this on a daily basis. Maybe if we can just run a quick poll, see where everyone's mind is, I think that's going to help us gauge where things are. So we've got a few polls that we wanted to run by. The first one is already on the screen. So I think it just goes back to confirming with you workforce optimization in aged care is critical. Uh, how important do you see workforce optimization in your organization? So just take a couple of seconds to read the question, look at as to what the options are, and share with us what you're seeing. And while we are going through the poll, I just wanted to sort of also put a bit more focus on some of the implications that James you mentioned as a part of your discussion. So the implications of not getting this right have got, there is a financial implication, which is where I think if you look at the agency costs are going up, and that's where it starts making an impact to the bottom line of the providers. There may be reputational risk associated with that because the star rating could get impacted, and I think that has got implication on how the provider is perceived. And then the last one is around care outcomes, which is obviously the front and center of what the sector delivers and what we are there to make happen. So I think it's good to understand where things are now. Can we go to the next one, Maddie, quickly? So we've got the second poll, which is more about how prepared we feel. So again, I think while we know that it's critical, and the feedback that I can see on the screen shows that it is critical, uh, we also wanted to get some pulse check on how do you feel your organization is ready to meet the needs, the workforce needs, and the obligations. Again, when you're looking at the workforce needs and obligation, think of it as an end-to-end life cycle, all the way from talent acquisition to onboarding, to retaining, rostering, and in some cases offboarding, and then everything that goes into creating that engagement and making sure that we get the right workforce. They feel that they are being listened to, and they are engaged in with the organization. Excellent. While we are waiting for the polls to complete, Tamra, uh, we have BDO and VC RSL Care has worked together on the broader transformation for more than 3 years now. And I think it'll be good for us to get your perspective, given that this is something that you live through every day. So maybe I'll get the spotlight on you, Tamra, for a few minutes. Just tell us as to who you are, what's your role at VC RSL Care, and I think it'll be great to get your perspective on what have you done so that VC RSL Care is more prepared to manage these workforce challenges and manage the optimization requirements that James was talking about.
Thanks, Kamal. So, yes, lovely to speak today. My name's Tamara Payton. I'm the Senior Executive Officer at Basie RSL Care. So my role involves backfilling for the CEO and other executives. I lead the HR portfolio and organisational-wide strategic planning and projects, and that includes the digital transformation work that we've been doing over the last few years. So Basie RSL Care is a medium-sized charitable organisation. We have about 650 employees and volunteers, and our purpose is to serve those who serve. So we provide accommodation care and support to military veterans and their families. And we do this through 4 service streams: residential aged care, community and home care, affordable housing, and transitional accommodation services for veterans who are experiencing or at risk of homelessness. So with such a range of services, we have a broad range of compliance requirements, funding challenges or funding limitations, and a lot of reform on different fronts that we're having to manage. And so we kind of took a step back 3 years ago and considered, do we have the systems that are fit for purpose to help us deal with all the change that was coming? And also with whether that's change that was being imposed on us or change that we wanted to make as an organisation. And were the software systems that we were going to be using set up to have a good user experience for our workforce, whether it's frontline staff or back office staff, our volunteers, and a good experience for our residents and clients that we were supporting as well. We've faced a lot of similar challenges to those that James raised. I think on a practical level, some of the things that we've experienced have been the challenge of being snowed under with compliance. It feels like in the last few years, compliance has increased tenfold with the amount of reporting that we're having to do to the department or to the commission. And without solutions, software solutions to help us with this, there's been a lot of Excel manual workarounds we've had to put in place, and that's been something that's been front of mind as we've worked through the digital transformation work of how can we automate some of those processes, or at least have reporting that provides the information to us in a way that we're not having to manually manipulate it before we have to submit it somewhere. You mentioned workforce challenges as well, James, and that's something that we've actually been very fortunate with. We have great retention. Our retention's at about 86% of our permanent workforce each year, and we get high numbers of job applications. But what that means is there's a high number of job applications to sort through to find the staff that are the ones that we want to bring on board. And during our digital transformation process, we have focused on making sure that we can get an applicant tracking solution in place that will have some efficiencies and smarts in it, that we're not having to click into every single resume, that it can bring forward for us the ones that we need to look at with some AI smarts behind it, so that it's not as labour intensive. We've also been very conscious of making sure that our software systems can talk to each other. When we reviewed what our pain points were before we started on our digital change work, one example we found was that just to enter a new employee in our software systems, to have them have the connectivity they needed on day one on the job, it involved 5 different teams to manually set them up in different systems just for them to be able to access their schedule and their online learning and our document management system and so on. And as soon as one person in one team made a typo, the whole system kind of crumbled, and the employee didn't have a great experience on the first day. And it's so important to us for our workforce that they do have a good experience from day one, because retention is such a big part of our overall workforce strategy. We want to make sure that we keep the great people that we hire. Yep. We do make sure that our permanent shifts are filled in our residential aged care homes, but we do still have a reliance on agency that we really want to work on, and this is a future focus for us. We're currently monitoring our care minutes in a very manual way. Again, Excel spreadsheets are featuring in there, and we are reviewing that on a fortnightly basis once the payroll has been run for the fortnight, because that gives us the most current data about our care minute usage. But that's always at least a fortnight behind. So what we have focused on with our digital solutions that we're putting in place is how can we get more live data or as close to live as we can get. And that's one thing that we have built into the new workforce management software we're going to be using, which is Dayforce. We'll talk about Dayforce a little bit more soon. But we have built in there so that our managers can see each day how many care minutes are rostered, and then each day they can see for the previous day how did the timesheets for the previous day stack up against what was rostered, so that they've got the rostered, they've then got what was actually worked, and they can see what their gaps are to be able to make decisions within the space of 24 hours about whether they need to add extra shifts on, or whether maybe they don't have to fill that sick leave shift that came up on the day.
Yeah.
With the volume of change, we've also just have the challenge of the amount of re-education of staff that we've had to do. When I think ahead to some of the change just in the next 6 months with new strengthened aged care standards coming, we have the higher everyday living fee structure coming in. There's lots of change happening, and all of that requires re-educating our workforce, which all is time that doesn't count towards care minutes. So it adds another layer on top of making sure you've got enough staff to provide care, that we have enough staff to backfill the high volume of training and re-education that needs to be done, on top of just the mandatory compliance education that we're doing all the time. So lots of challenges, but we do think that where we're going with our digital transformation project is helping us resolve some of those. So what we have done over the last couple of years with the support of BDO is reviewed what our needs were, gone through quite a thorough vendor selection process, and we have implemented a new ERP system, including a CRM. So that's for our finance team and for intake of residents, clients, and program participants across all our services, which straight away is a bit of a magical thing for us, because it means that if we have one person who has come to us, regardless of which service it is, we can easily then transfer their details to a different service. So if somebody who's getting in-home care wants to go to residential aged care, we have them within the one system, whereas previously we didn't have that. It was like they were dealing with two different organisations, even though it was the same organisation. So the system we've put in there is Epicor. Some people on the call today might be familiar with it. We've got a new HR and workforce management system, which includes payroll, learning, and various other modules in the form of Dayforce. We've implemented Sandwy in our home care team for rostering there. And we've introduced a new incident management system called CAMS. And we've added a layer that connects these systems so that the key information that's needed in multiple systems is able to flow from one system to another. Which removes a lot of that double entry, triple entry, sometimes quadruple entry that we were doing of information. So that's a little bit about what we've been doing, Kamal.
No, that's interesting, Tamara, and I'm really intrigued by the journey and the commentary that you provided. I think the role of digital is not only in that human capital management space, but it's more broader that you were talking about. But I think it's all of that investment that VC RSL Care has made. Is to make sure that there is a focus on staff experience, how we make their life easier, and all of that leads to better retention, and that leads to being able to manage how we deploy them, how we train them in the most effective manner. So I think that's a big part of the message that I heard. The second part is it's not only about setting and forgetting, it's making sure that those activities are giving us as live data as possible. We are able to make decisions more quickly, from moving to a fortnight old information to get visibility of where the care minutes are landing. Now you can do it within 24 hours. And I think that's helping you not only manage the team, but also keeping on top of how the allocation is happening, how the care delivery is happening. So I think you've been on a journey for quite a while, and I think I'll touch upon that change part that you mentioned, Tamara, in a minute. But I think we ran the poll to understand as to where the participants are in their journey, and also how important they feel it's connected to what the organization is looking for. So I think if I look at what results we've got, from how important the workforce optimization is to your organization. A majority of the participants have said it is a key priority, which sort of lines up with what James and Tamara you mentioned. If you go into the poll results for the second one, where we did talk about how ready we feel for meeting our workforce needs and obligations, I think it's a much broader spread there. So I think there are some organizations or some participants who are suggesting that they don't feel they're ready, but there are a majority in the middle band, which we said we have a plan, but securing resources is a challenge. And we do have a staff, but the challenge is around ongoing monitoring and maintenance, or ongoing monitoring and management. That's great insight. Maybe Mark, I'll pull you in because I think all of this discussion is highlighting that managing workforce, optimizing the teams that we have, that is a high priority. There is challenge in managing it on an ongoing basis. Tamra did highlight the importance of digital solutions in making it come together. You work with clients day in, day out. You are from Dayforce and you've been engaging with a number of clients in the sector. Can I get you to introduce what you do and what capabilities Dayforce is bringing to the market? And I think it'll be good to get your insights on specifically how clients are using Dayforce to address some of the challenges that Tamara and James were talking about.
Absolutely, Kamal. I want to thank James and Tamara for their insights there. It's really helped us a lot in terms of how we can provide a better service to our own organisations and customers that we support, particularly with our partners and strong partners like BDO we have in this space. I'm Mark Suter and I'm privileged to be with you here today. I'm an HR director by background. I've been working with HR technologies for best part of 20 to 25 years now. As a decision maker in terms of purchasing, implementing, and also working with the solutions to make sure we get the value out of those and how does they be articulated in terms of a return on investment to boards and other key stakeholders. I work with organisations that are looking or considering Dayforce and really looking to validate and quantify the bankable benefit and also non-bankable benefit when it comes to a solution like Dayforce and how we can provide great support and services to meet these compliance requirements and others that Tamara and James were talking about earlier during today's session. It was interesting to see the poll results come up there. I think that the complexities there and many of our participants today are looking for solutions to this space from a people and a talent perspective, but also from a technology viewpoint. And the reality is that it's a combination of all those different areas to meet the need. What are we seeing from a Dayforce perspective and meeting the needs and trying to predict what's happening in this space? What we realise at Dayforce is that in this area, in this industry around aged care and healthcare, people come to work to look after our most vulnerable in the community, or some of the most vulnerable in our community, certainly some of the most loved, as many of us here would have families that we're part of or have elderly parents. They don't come to work to fill out spreadsheets, timesheets, all these different types of areas that take them away from the primary care that they're looking to provide. And what we're looking to try and see is how do we get people to focus on those areas versus the administrative challenges that are there. The administrative challenges that we talked about and James was mentioning earlier are very real, particularly around care minutes, also particularly around reporting structures that I'm sure Tamara has to do, particularly around WGEA and others. And these sorts of areas, we're looking to really release people to focus on the things that count. So we realise that it's difficult to stay ahead in this space, but with great enabling technologies like Dayforce, with great partners like BDO, and also talented people in spaces like Tamara holds and also support from James, I think we can find an aid to address these legislative requirements, but also importantly, making sure we're taking care of those people that are so important in our community.
Thanks, Mark. And I think the big part of what Dayforce is bringing into market is a platform that brings all the data together, enables the
Yes.
transformation for managing the end-to-end employee experience, all the way from the day they make an application to work in this space, to maybe if they are continuing with their careers or they are moving into something else. Now, maybe James, I'll bring you in. We did talk about the role of digital, and how platforms like Dayforce is bringing things together for our clients. Now, what are you seeing, James, in terms of how aged care providers are going through that change in how they manage that operation, digitalize some of those capabilities, and perhaps maybe also some of the value that they can generate from it?
Yeah, I think as Tamara suggested, there's a lot of providers are still doing this manually, looking at their care minute targets, and that's just going to, as Tamara said, the workload that adds to providers is significant. What we really need to do is be able to report on our care minute targets, and we also need to be able to drill down to, are you meeting your care minute targets for each wing? Now, there's no regulatory requirement for this, but if you've got a memory support unit, the resident profile will dictate what the care minute target should be. So, and remember, with that commitment to person-centered care, we should be able to pull out of the data from our ANAC profiles, what is the target for that particular wing, and try and meet that. I say try because there's going to be some physical limitations around that. It was interesting that when they originally talked about care minute targets, they said the only sort of obligation would be around your star rating. So we've got to have a minimum of 3-star rating, and it would be published if you didn't achieve that with your quarterly QFR report, that your star rating would go down. We now know that the government is taking regulatory action. I spoke to a provider yesterday that's received a undertaking to remedy requirement to achieve their care minutes. So we know we are going to look at this. This is back to the future for us, because any of you in the room that are listening to this who are in my vintage, remember we had a system called CAM and SAM, and under that it was direct care. There was a requirement, not minutes, but dollars. And if you didn't spend 100% of your funding, in fact 98%, then the government would take the funding off you. So it was a disincentive. I think the government, and hearing the minister at the ACPA conference just recently saying, we've given you the funding, and you saw that before, about the 75% of ANAC is appropriate. Our obligation as providers is to provide this. Now, I think every provider listening to this presentation is keen to meet their obligation. The issue that we found back then and what we find now, you only need, we've all had those situations where you could have an outbreak, you could have people, who are injured in the course of work, workers' compensation, and taken out of the workplace, who are responsible for delivering care at short notice. And it may be difficult to replace them in a timely manner. And in the past, we referred to it as having to work short. Every hospital, aged care facility, healthcare organisation I've ever worked in, that term is certainly not unusual. What this means, though, moving forward, and again, as Tamara talked about being able to monitor this regularly, if you have a fortnight where, for example, you have to work short, one carer is off for whatever reason, you've now, remember we operate 7 days a week, so we've got 38 hours to cover in the weekend. We've got another 32 hours on the weekend. We're now going to have to backfill. What does that look like? Are we going to add a carer next week? Just a floater, if you like, someone extra to be? How are we going to meet this? And if we don't address it in a fortnightly basis, we could be getting towards the quarter and realise that we're in a huge deficit. Or we could be over as well, depending how you set your base roster, and that's not financially sustainable. So, as I said, we're only funded to provide 3 stars.
Yep. I think we've sort of if I go back to James, you started with the challenges. Tamara talked about as to how ACRSL is addressing those, and obviously Dayforce is a big part of what Tamara was doing, and Mark started bringing to life as to what capabilities are getting into the market. Maybe I'll just quickly go back to you, Mark. I think we missed out on some interesting statistics that you wanted to share with us in terms of where you see the sector. Maybe can I come back to you and say, uh, what is the you are a global organization, and it's a lot of the things that you look into is not only what's happening in Australia but also what's happening globally. Do you want to share the interesting statistics that you had for us, and tell us as to what that all means for it?
Yeah, Kamal, this is not a dissimilar result to what we just saw in our pulse poll a couple of moments ago earlier in our session today. What we're seeing is that multiple different systems and approaches are in aged care, and a lot of it is manual, which is taking away from important care minutes to residents and others that we support. We see multiple systems where people are swivel chairing, if I can use that term, going from one solution to another with multiple different experiences, multiple different training needs, and also making sure that you know uh, making sure that it's in that scenario, very difficult to bring those data points together. We see a lot of reliance on unstructured ways to pull this data together. And I'm sure that lots of people who are participating and listening to the conversation today, they're using things like Excel documents, emails, telephone calls, hard copy forms, multiple different systems, and so on, creating a very convoluted and somewhat confusing solution to try and meet these requirements and needs of service in the community. Um, a classic example of that is mentioned before, the WGEA report. Sometimes that could take up to 6 months for some organisations to produce. But with Dayforce, we've seen some of our customers do this in a matter of days just by clicking on a button. We know that that data point is important, and this is something that we're looking to solve with an enabling solution with great partnerships like BDOs, two organisations that we've seen here today. I've got some more information here, just one more piece of data that could be relevant in terms of the healthcare workers, right? Um, Only 13% of healthcare workers feel appreciated by their employers. It's across the board. If we start to think about the aged care sector and the types of personas that are working in this field, traditionally they are people potentially from an English as a second language background. And how do we make sure that these people feeling appreciated? How do we accommodate those in the workplace? And how do we make sure that these individuals that we're supporting are using the same sorts of solutions inside the workplace that they're using outside the workplace. So, for example, if they're using mobile devices and other ways of connecting and doing their day-to-day consumer work, like, for example, their banking, their grocery shopping, paying their bills and others, why aren't we doing the same thing internally for our own staff, right? We need to respect the year that we're in, 2024. Let's give them 2024 solutions too, so they can come to work to do things that count. We recognize that these sorts of areas are really important for us to bring together to release people to do the things that count. We just thought it was important to point that out, that this is really about an employee experience lens as well as a compliance one, as well as creating those efficiency gains that are so important to return back to the organizations that we're part of and provide great services to those residents who are part of the organizations. Um, we want to be focusing on the person's experience, not just the corporate lens. Keep in mind what sort of customers, or our customers' customers, so to speak, are looking to try and provide this space.
Thanks for that, James. I think the big part of what I picked up from your insights was there is a technology piece. There are capabilities that are coming into the market, but it's also about experience, and it's also around making sure that we are meeting where people are, rather than providing something which doesn't line up with how they manage their day-to-day life. It's the human perspective enabling some of these changes, or how do we bring the technology to help people out. Now, Tamara, we did start talking about the change piece, and the diversity of the workforce, English not being the first language, and all of those aspects that Mark was talking about. You've been through that change. Tell us as to what worked, what didn't work, because I think we don't want to. There are lots and lots of capabilities available in the market, but it's not about having the right technology. It's about doing it in a way that makes it a part of everyday processes, and making sure that the people are coming on that journey. You've been through that process. What's your insight?
Yeah, and coming to the end of the process, well, or maybe starting the next stage of the process. So we're just about to cut over our data from our current systems, our legacy systems, into Dayforce with an anticipated go live early in the new year. So we're getting very close, and we have been talking with our staff about what the impact of this change will bring for their experience as employees. And there's lots of selling points, and I really like the description that was used earlier about the swivel chair. That's been one of the key selling points, is instead of going to 5 different systems, one for your leave and one for your performance management and one for your learning and so on, everything is in the one location, and it's got that mobility and flexibility of being in an app, so that if you're sitting at home on the weekend, and not that we're trying to encourage staff to work on the weekend, but if you're planning your holidays for the next year, you can put your leave application in straight from your mobile phone. So it does make it very easy to use, and even for a workforce for whom a lot of them are not confident IT users. So that's been part of the selling points we've been sharing with our frontline workforce, and some of the training that we've been rolling out to them in preparation for go live. For our managers, they're very excited about the Care Minute dashboards and reporting that we've built in to Dayforce, so they can see their scheduled care minutes, as I mentioned earlier, and they can make those real-time decisions. And it also gives managers access to information that they haven't been able to see in our previous systems to manage their staff's performance. So just as an example, our managers have never been able to see a summary record of employee sick leave if they've noticed that a staff member has been taking a lot of personal leave, and they've had to go directly to payroll and ask payroll to prepare a report for them. When we go live with Dayforce, they will be able to run their own report from their desk and have access not just to see how many days have been taken, but how many days have been taken with a medical certificate, how many days have been taken with a stat dec, how many days have been taken without evidence. And for those in the aged care sector who have enterprise agreements like ours, where it breaks it down like that, this is a level of reporting that is going to change the way that the managers are able to respond to issues like excessive sick leave. And you talked a little bit about engagement. One of the things that I'm excited about with Dayforce is it does have an employee engagement module in it. One of the reasons our retention is so good is the culture that we have and the experience that we do give our staff, but we want to be able to stay on the pulse of any changes to that, which means we need to be able to measure that effectively and see changes over time. And we've been somewhat restricted up to now to tools like SurveyMonkey and so on, which great tools, but it's going to be a lot easier to manage when it's all integrated into the one platform that employees are used to going to for other reasons. We're going to get more engagement when we put surveys out, and we're going to be able to track data over time across multiple surveys. So that's particularly exciting for us, along with the efficiencies our back office staff are going to get, which the automation we will get around compliance and the time saving from not doing all that double entry will mean that we can be more proactive in the way that we're working rather than reactive. We'll be able to proactively audit for compliance rather than reacting when we find problems bubbling up. Or we'll be able to more closely match our recruitment timing or our volumes to the care needs that the Care Minute needs that we can see happening live in the schedule. So yeah, there's lots of advantages, and we think it's going to have a much more positive experience for everyone using the system, which has the knock-on effect of a much more positive experience for our residents, our clients, our participants in our programs.
Wonderful. I've worked with you, Tamra, for a number of years. I engage with you, Mark, often as a part of my Dayforce journey. And James, we have worked on a number of projects together. Every time I have a chat with you on this topic, I learn something new. Hopefully, we have been able to actually share some of those insights with the broader audience through this webinar. Um, we'll take some questions because I can see some questions coming from the audience. And we'll start taking some of those questions now. I know that we might not have time to answer all the questions, we will come back to you with responses separately after the webinar. But one of the themes that are coming across a number of the questions is there is lots of capability in the market. There is lots to be done. There are a number of things to be taken care of as we initiate or start thinking about workforce optimization, digital solutions in this sector. Where do we start? What could the first step look like? And maybe Mark, I'll get you to share your perspective on that. Where should the question is simple, but it's a difficult one. What should be the first step?
Yeah. The first place you should start is where the compliance and business needs are. Once you understand what that looks like and what the priority looks like, then you're going to get stronger attachment in terms of support across the organization. So we're not looking like we're solving just an HR or a payroll problem, right? So if we're going to start with the business needs first and tie this project to that with demonstrable return on investment, with bankable and non-bankable benefits, is a certainly great place to start. The other place to start with is with your employees in mind. How do they learn? How do they consume information? What works well in your organization? Does do they respond well to things like on-demand learning, or do they respond well to messages being sent through their line manager for addressing that sort of change? But these are the sorts of areas which I would start with. Number one is around the compliance standard, tying it back to the business need, but also creating that business case for change. Importantly, going back and saying to the business after a while, look, this is the actual generation of return we've got, so that they get more confidence in giving HR the kudos that they deserve and also the payroll teams that they're part of. The second part, again, is just really around that employee experience piece and how do we make sure we're accommodating those learning needs so they're actually using it and enabled, and also adopting and using the solution in place to get these needs and requirements that we all are aware of on this call.
Wonderful. That's great perspective, Mark. Thanks for that. James, there is a question which has come straight for you, and it says, "Question for James." The question is, what's the record of operators meeting total care minutes, not just RN minutes, and what do you expect will be the outcome in the December quarter when care minutes increase significantly?
Okay, so I'm glad I know the answer to this. So the government has proudly reported that the average, well, before October, before it went to 215, and I think off the top of my head, they proudly reported, there's dashboard reports that you can look at this that the government put out. So I think we were achieving, instead of our 200-minute average target, we were achieving 202 minutes. But when you read into the detail, only 36 of providers were actually achieving their required target. And most of that fell down in the RN requirement, their minutes, not the 24-hour one. We said 92% achieved that. So what we know, that tells us that there's a lot of organisations that are actually providing over the minimum, the 3-star rating, which is perfectly fine. But again, it's unfunded. I don't know how people are paying for a workforce above a 3-star rating.
That's great, James. Tamra, there is a question, and this links back to one of the topics that you touched upon earlier. There are some challenges. There is a place to start, which Mark was highlighting as to how do we get onto the journey. given that you're towards the end of the transformation, it's not about starting, but it's also about maintaining. So, uh, can you share some perspectives in terms of, what measures or what metrics do we need to put in place so that we know that we are in the right direction and we are staying the course?
Good question. So a couple of things I can think of. One is making sure that you've had a robust change process up to that point. So you've got a good starting point when the systems are implemented, people are on board and they're using them. So yeah, ensuring your change process is solid to start with. We have also delegated some responsibilities within our workforce for software owners and software SMEs. So, amongst the executive team, executives are designated as software owners, as responsible for a particular software solution that's used predominantly in their team, even though it might be used more broadly. And then within different departments, the SMEs are responsible for, as well as their day job, but making sure that the system's being used properly, that any changes in business need are being identified and can be reflected back in the way that we use the software solutions, that we are user acceptance testing anytime there are changes to the solution, like upgrades and so on. And they're almost that litmus test that everything's working as it needs to be. But we've also built into our change process that we will do an evaluation or a review down the track. Nothing stays the same. So we want to make sure that we review the work that we have done, but also look forward to the future needs and what we will need to do at that 6 month or 12-month point, looking ahead to our future roadmap as well.
Yeah, just on
Excellent.
that point, Tamara, if I can add something, Kamal, it's so important that it's not just about the go live. We see that as the start now, and being able to understand what that governance process looks like. Because with a software as a service solution, innovation is going to be delivered to you on a quarterly basis, and Tamara is going to have to make decisions around what features and functions are we going to use, which ones aren't we going to use, how are we going to get people to use this, all those types of areas. Like we've got some great solutions coming down the path, particularly around on-demand pay, which I think is going to be a game changer for our workers in the aged care sector. But these sorts of areas are so important. How are you going to govern this solution? How are you going to measure the return on the investment? And also importantly, how are you going to maintain and make sure that these solutions are getting the return that you're investing in from a compliance perspective, but also from a return on investment perspective, but also from, importantly, the staff that we're supporting, if they're getting that enablement that they need to provide the services that they do every day in the aged care world.
And it's a fascinating topic, and it feels like we're just warming up when we've come to almost the end of the time that we had together. But just if I can quickly summarize as to what we covered. So we did talk about the reasons why workforce optimization is critical, including the regulatory changes and the financial drivers behind that. We touched upon how things are evolving in the next 24-36 months. Tamara did and Mark together, both of you talked about the role of digital in reimagining the staff experience and delivering the workforce optimization. And we talked about some of those things that we need to keep in place, not only when we start, but as we progress through this change journey. Now, there are so many other questions that I can see on the screen. We didn't get a chance to cover even half of them, but I would a massive thank you to all of you. You brought different perspectives into the conversations. You gave your time to us, and it was really insightful. Thanks to all the participants who joined the session. We will follow up with you with more details. You will get a link in the email where you can register your interest for not only the webinars that are going to be coming in this series, but also the broader insights that we share with our clients. So with that, thanks a lot to the panelists. Thanks to the participants, and let's stay in touch and keep the conversation going. Wonderful. Thanks, everyone. Have a lovely day.